Have you ever wondered why people snore in their sleep? What causes snoring and its effects to oneself and people around them? Well, specialists say nearly everyone snores every now and then.
Snoring is noise that occurs during breathing because there is maybe turbulence of air either in the nasal passage, in the postnasal space, but is behind the nasal space, in the oropharynx, or even a little lower at the base of the tongue and lower. So if you have anything causing or obstructing airflow, then it will be noisy. Most people will snore once in a while, which is not a problem. Especially if you go into deep sleep, you can snore. But also if you take things that cause muscle relaxation.
Snoring can be a nuisance to those within earshot. Severe snoring restricts airways, causing one to dramatically wake up for a brief second, forcing airways to open, after which the pattern begins again. The result is chronic sleep deprivation. And while most people don't seem to know the seriousness of snoring, often joking about it, or simply don't realize the health implications of the act.
One thing that is quite interesting is that most people don't actually understand that snoring has psychological effect on both the person who is snoring and the family members or the people that are around the person. And it is important for everyone to first understand that just as it is a physical issue or problem, it could be a medical issue, it is also a psychological issue.
In children, mostly will snore because they are blocked in the nose or they have tonsils or adenoid. Adults will snore for different reasons. They could be overweight, they could also be having bulky tongues, or the palate is loose, right? But the point where people get concerned is where you find they sleep, then they stop breathing and startle.
Although people of any age, including children, can snore, statistics show that it is more common in older people, with men snoring often than women. There are several grounds which lead to snoring. Lifestyle changes and increase in weight are the two leading causes. However, specialists say one needs to watch out because excessive snoring may end up being chronic, and sometimes it may also indicate a serious health condition.
If you take things that cause muscle relaxation, like alcohol, etc., you'll find those who drink, when they drink, they snore because their muscle tone goes down. Or if you become overweight, you'll snore.
If someone lies on their back, like sleeping on your back, you are likely to snore because eventually the trachea narrows as you sleep.
Snoring can be triggered by a number of issues such as anatomy of one's mouth and sinuses, among others. It is often associated with sleep disorder called obstructive sleep apnea. While not all snorers have obstructive sleep apnea, some indications may show exactly the seriousness of it in the person snoring.
The point where people get concerned is where you find they sleep, then they stop breathing and startle. What is called sleep apnea. It can happen at night. You find there are people who will sleep and stop breathing, then wake up again. Whoever the spouses or whoever they are with, or even if they are babies, you find the parents keep watch because when they stop breathing, they don't know whether they'll continue stop breathing or not. And it's worrying. Now you should be worried or if you snore to a level whereby you disturb your neighbors, or you disturb your spouse, because it has been known some people moving out of the bedroom.
Habitual snoring may be more than just a nuisance. Aside from disrupting the bed partner's sleep, if snoring is associated with obstructive sleep apnea, you may be at risk for other complications. Obstructive sleep apnea often is characterized by a loud snoring followed by periods of silence when breathing stops or nearly stops. This pattern of breathing pauses may be repeated many times during the night, causing serious effects of oneself and the people around them.
The person who is snoring, we can't really underrate the fact that they get affected psychologically. One, their self-esteem goes down. Reason being, not everybody is comfortable with them. Nobody wants to be around someone who is snoring. In the middle of the night, you're woken up by someone snoring. It's very uncomfortable. And so people start talking about this person who is snoring and, like teasing them, telling them how badly they do it. And so this affects the person's esteem.
It interferes with work, interferes with performance. If they're in school, it interferes with school. If they are students, even children, These are people who procrastinate if it is reports or reading until the last minute because it is demanded.
If they don't get support, they might end up isolating, withdrawing from others. They might choose, let's say it's a person who is married, they might choose running away from their spouse, not spending the night with a spouse. Maybe they choose a different room, or they choose completely not to be in that home.
Many children may snore at some point in their lives, especially during bouts of colds or when their allergies are acting up. It's often a passing phase, but in some cases, it is a habitual problem that requires treatment.
In children, mostly will snore because they are blocked in the nose or they have tonsils or adenoid. If it's in babies, you see, it means that that working of the heart also makes the heart grow larger. And they could end up having hypertension in the lungs. And in adults, the same, they can get that hypertension, but can translate even to hypertension during the day. As a parent, you see, if they have sleep problems and they breathe with their mouth open, they stop breathing at night and get those apneic attacks, you go see a doctor. I'm sure he'll look and see what is causing the problem. If it is adenoids are removed. They'll examine and they'll tell you what is the problem.
Lifestyle changes can help stop snoring, and in some cases, other treatments may not be necessary, as doctors say. Even when other treatments are prescribed, lifestyle changes are often still recommended. The reality is that snoring is not normal. It is serious and it can be helped.
It is important to change your position. There are people who find it comfortable just lying on their back. In this case, if it is a child who is snoring, can the parent support them by checking on them often so that they can help them turn and lie in a different position? If it is your spouse and you hear them starting to snore, don't ignore it, don't start cursing. Just help them. You could even wake them up and help them turn. That way, you are able to address more serious challenges that would come with this if you can just sacrifice to do that.
If it comes because you have taken alcohol, then you can stop alcohol. If it's smoking, stop smoking. If you have added weight, reduce weight. So it is preventable in that sense. But if it is occurring because of an anatomical problem, such that you have a growth of a tissue in the nose or something like that, then you can't prevent that unless you know the cause. If it was caused by allergy, then you could say maybe take care of your allergy, the swellings will reduce.
Then, of course, avoiding heavy meals just before you sleep. That also works very well for the people who snore. You don't need to sleep in a very constrained tummy, which is full of ugali and githeri and all that. Yeah, you need to reduce your intake of food, especially heavy foods, just before you go to sleep, because that will help in how you sleep. It will help in your breathing.
We leave you with 10 interesting facts about snoring. Did you know snoring is common but is not normal? Did you know there are about 15 million snorers in the UK, where 10.5 million are men and 4.5 million are women? Did you know snorers are 3 times more likely to suffer adverse health conditions than non-snorers? Did you know bed partners of snorers report that they have just 3 to 5 hours of sleep per night. Did you know bed partners of snorers visit their general practitioner more frequently than bed partners of non-snorers? Did you know over 1/3 of couples report disharmony within the relationship due to snoring? Did you know the louder you snore, the more likely you are to be overweight? Did you know more than 50% of patients with obstructive sleep apnea have high blood pressure, whereas only 25% of patients with blood pressure have obstructive sleep apnea? Did you know regular snorers are 5 times more likely to develop hypertension, heart disease, stroke, type 2 diabetes, and high cholesterol than occasional snorers? Did you know more than 1,000 studies of sleep deprivation have been published during the past 100 years? Faith Imanimugo for Hope TV Newswatch.